Oh, nice. That's a very pleasant thought.
Absolutely.
Can you tell me the difference between the four stages of cancer
Okay.
in layman terms?
So देखो, any cancer which we treat,
Ji.
treatment depends on two things. What type of cancer it is, होता है
Hmm.
ना genetic types ये सब, and what is the stage of cancer. So stage of cancer simply means how much the cancer has spread.
Hmm.
Is it at one place? Is it at multiple places, and so on. So stage is different for each cancer.
Ji.
Okay. So for example, if you talk about breast cancer, 1, 2, 3, 4 are different. If you talk about stomach cancer, 1, 2, 3, 4 are different. Kidney cancer, 1, 2, 3, 4 are different.
Acha.
So for each cancer, staging is different. And as oncologists, we have to memorize for every cancer. So for every cancer, I have to remember what is stage 1, stage 2, stage 3, stage 4.
Huh?
So which is completely different. For breast, it is different. For mouth, it is different. For tongue, it is different. For throat, it is different. For esophagus, it is different, and so on. But I'll tell you briefly what is the
Ji.
staging system.
Ji.
So stage 1 is usually a cancer which is small in size
Ji.
and it is located where it started. Okay. So
जी.
for example, suppose किसी को breast cancer है, तो what we say is a tumor which is less than 2 centimeter and nowhere else in the body.
Ji.
That is stage 1 breast cancer.
Ji.
So it is small in size and located where it started. Okay. So stage 2 is any cancer which has spread a little bit, but it is mostly still where it started. So it might have increased in size. It might have invaded the adjacent space. Okay. It might have gone deeper. So suppose in the colon. So colon में क्या है कि there is a layer of cells. There is an inner layer, inner. So our cancer which is only in the innermost layer of cell, that is stage 1. Once it goes deeper and invade the next layer of cells, it becomes stage 2.
Okay.
Similarly in breast, suppose it increases from 2 to 4 centimeter. It is stage 2. In tongue, a tumor less than 2 centimeter stage 1, 2 to 4 is stage 2. So it is slightly bigger, but it's still mostly in the same place. Stage 3 is a cancer which has spread from the site where it started a little bit, but it is still not spread all over the body. So, for example, suppose the rectal cancer, the colon cancer, it spread to the lymph node which is near the colon.
The tumor.
So, it is stage 3. In breast cancer, if the cancer spread to the lymph node under the neck, it is stage 3. In tongue cancer, it is spread to the lymph node in the neck, it is stage 3. So, a cancer which has spread in the local space is a stage 3 cancer, and beyond that everything is stage 4. Okay. So any cancer which has spread beyond the local area, it is stage 4. So suppose a breast cancer is there and there is a single lesion in the liver, it is stage 4. Even if the cancer is 1 centimeter, if it has one lesion in the liver, it is stage 4. Why it is stage 4 is, see, to reach the liver, that cell had to
Travel.
travel a very, very long route, and it had to gain the ability to spread
survive.
to the liver.
To not let
So it
immune
had
system
to,
know.
yes. So from a normal man, it had to become Superman. So it is not a matter कि liver में एक cell है. The problem is जो patient का cancer है, वो genetically advanced है, वो genetic रूप में, उसके पास वो ability है जो stage 1 वाले के cell में नहीं है.
Stronger है.
It's a stronger cell. That is why it is stage 4. So the ability of a cancer to spread to a distant organ implies that it has genetic mutations which allow it to evade the immune system, evade your treatments, and in general be much more stronger. So that is why these patients do worse than stage 1 patients. So grossly, stage 1, small local tumor, stage 2, large local tumor, stage 3, regional tumor, stage 4, spread tumor.
Beyond the local area.
Absolutely. So grossly. So there are a lot of differences. For example, brain tumor, we don't have stage 1, 2, 3, 4. Because see, they usually don't spread outside the brain. So we have grade 1, 2, 3, 4 in brain. There's a different concept. And in testicular cancer, we don't have stage 4. होता ही नहीं. Even if the testicular cancer spread to the lungs, it is still stage 3. So there is no stage 4 in testicular cancer. Because if a testicular cancer spread to the lung, even then the cure rate is 80 to 90%. So there is no stage 4 concept in testicular cancer. So there is only 3 stages. There is no stage 4.
Oh, that's also
So
very
Yuvraj
interesting.
Singh had a germ cell tumor. It is a kind of, it was not a testicular cancer, but it is a cancer of the same family. And when his cancer was diagnosed, he had a 99% cure rate at that time. So these are very, very highly curable cancers. So in these cancers, we don't use the word stage 4. क्योंकि stage 4 होता ही नहीं in cancer में.
अच्छा.